Welcome back to Houston Life. It is a common fear for so many people going to the dentist. And that was the case for our next guest, Sheila George. But when Sheila started having issues with her teeth, she found herself visiting the dentist repeatedly for a patchwork of what she calls temporary fixes until she found a more permanent solution. Here with more on a procedure she says brought her life-changing results, Sheila George, along with periodontist and the founder of Texas Dental Implant Center, Dr. Michelle Azar. It's nice to see you, Sheila. It's very nice to meet you.
Nice to meet you.
Recently married, by the way, in February. Congratulations to you.
Thank you.
For someone who hates going to the dentist, you sure found yourself going to the dentist a lot. Root canals, crowns, cracked teeth. Describe to us what led up to this procedure. What issues were you having?
It was the eating issue, because I was missing the teeth, or I'd have to go, one dentist does a cavity fill or whatever. You have to go somewhere else to get a root canal, somewhere else. It was just constant.
And you felt like it was a patchwork of fixes over the years.
Right.
These are your before photos. Sheila, you look like a completely different person now.
Thank you.
You do.
I feel like a completely different person.
Yeah. And that bright smile. Is it true that you were kind of hiding your teeth? You avoided smiling?
Oh, true. Yeah, I would kind of talk. You know, when I saw him for the very first time, I had the 5 root canals done in one day.
Oh my gosh.
But then I had two, the front tooth just break off by eating a piece of bread. Mm-hmm. That's why I went. And I said, I'm tired of putting a Band-Aid on the problem. I need a whole solution. Walked in, very comfortable, even though I'm fearful of dentists, very comfortable. He explains exactly what he's gonna do step by step. And my first question was, do I have enough bone?
Yeah. And that is a common question from patients, right? Who are told by other periodontists, like, oh, you have so much bone loss, we can't do anything for you.
Yeah, we were just talking about that. A lot of patients come in, the first question they ask me, do I have enough bone for this procedure? And I look at their x-rays and I look at my assistant, and we've done much harder cases. What are you talking about? You have plenty of bone. We just need to use the right technique to utilize the bone.
Well, okay, so I think that's really interesting. Isn't bone loss, though, a common reason why someone might be having repeated issues with their teeth over the years?
So bone loss, in our terminology, meaning periodontal disease, meaning the teeth are losing bone and the teeth are now mobile or loose. And a lot of misconception happens here because I'm losing bone. Do I have enough bone to place implants? The bone that we need for implants is different than the bone that we need for teeth.
Is it true also that periodontal disease can be genetic? It can run in your family?
Yes, to a big extent. So 50% of the population will have some sort of periodontal disease. And by the age of 60, that percentage increases to 70%.
Wow.
So that means that it's more than likely happening. It's silent until it becomes too severe or too painful, and then you start to see the dentist because it's too painful. But once it's painful, it's sometimes too late to address it.
Okay, so it's important to have regular visits to stay on top of it, even though it is a common disease.
Right.
The good news is there are fixes. I mean, you're proof of that, Sheila. Your smile is so beautiful.
Thank you so much.
It looks
I love it.
And is it true you pushed off your wedding a few months so you could have your new smile just in time to get married?
That is true.
Walking down the aisle with those pearly whites, I love it. Okay, so let's talk about this one arch procedure, because a lot of folks, Dr. Azar, and you can see Sheila's dramatic before and after photos. How does this work and how long does it take? And maybe viewers have heard us talk about this before. We love when you come on to describe it. One day in most cases?
Yeah, so one arch procedure is a one-day procedure. The same day that we take out the teeth, there's no waiting time. We place the implants to where the existing bone is, and then we put the immediate teeth right away, which are fixed in the mouth. And we refer to this set as the healing set. So you walk out of the clinic, no downtime, you have the teeth right away. And in a couple of weeks or months, we give the final teeth in. That's actually an important scan of here. So whenever a patient comes in to a consult, a lot of them don't know what's happening in their mouth. And we take a 3D scan of their mouth. And I sit down with them and study their mouth from every angle. Like, you have a decay here, this tooth is breaking, you have missing teeth.
Wow.
And on the back end, we design their future teeth. That's why that image right here, it shows how her future teeth are gonna look like, the bite, the cosmetics. everything is digitally designed. So it's not too far off from what she had before, like the dimension of the teeth, the spacing in between them. All of that is very customized and it's computer-based.
I think that is so incredible. Just this digital lab that you can see the issues going on with your teeth. When you saw like your existing mouth, your previous mouth,
right?
I mean, that's pretty dramatic.
It was shocking.
Yeah.
Who would have known?
It's hard to see these angles too without that scan.
Yeah, but knowing like this is the reality of what's going on in your mouth, that's important information to have.
Oh, sure.
Okay, so describe to us, once you got your new teeth and you had this procedure, how did you respond?
It was, well, I just busted into tears in his office, in the chair, when they first showed me the teeth. And then I said, you have to hug me. I'm a hugger. Come give me a big hug. And he did. And I said, I'm amazed. They're mine. They're paid for, they're mine.
Yeah.
But what a beautiful, beautiful transformation.
And they look natural, they look beautiful. So part of having a beautiful smile, we talked about how you would hide your smile previously, but also the functionality of having bad teeth can be highly problematic. You were saying eating food, even chips and salsa,
absolutely
was tough for you to eat previously. Well, my goodness, you live in Houston, you gotta eat chips and salsa. Dr. Michelle Azar, Sheila George, congrats.
So nice to meet you.
Great to meet you. I'm very happy for you.
Thank you.
Congrats on your wedding. I'm kind of mad I wasn't invited. Just kidding. So the Texas Dental Implant Center does have a special offer for Houston Life viewers. Here's the info on your screen. The first 20 callers will receive a complimentary consultation after a short pre-qualification call that includes a one-on-one chat with Dr. Azar, a 3D scan and x-rays, all valued at $1,000. To schedule your appointment, you can call 346-1ARCH. That's 346-663-2724. You can also go online, bestdentalimplantshouston.com. And if you're on social media, you can follow them, Texas Implant Center, to see more patient transformations. And we will be right back with more Houston Life.